Child Abuse, an Issue in Society by me, Kaylee Clements. Before we begin, I want to go over a little bit about this PowerPoint. I am looking at child abuse and the cures for it in a sense in more of a clinical psychology aspect because I am going to graduate school starting in July for clinical psychology. Before we begin this PowerPoint on child abuse, we first have to define it. So what is considered child abuse? There are 5 different categories of child abuse, beginning with physical abuse, and that would be considered striking a child, kicking, anything that may cause them physical pain. Sexual abuse, which is inappropriate touching of the child, rape, molestation, or forcing the child to touch someone inappropriately. Emotional abuse would be considered belittling the child, yelling, taunting, or withholding any emotional relationship with the child. Medical abuse is refusing necessary medical attention or fictitiously causing medicinal care, such as Munchausen by proxy. Neglect would be withholding proper needs, shelter, food, care, clothing. My graphic to the left says nearly 3 in 4 children, or 300 million children worldwide, ages 2 to 4, regularly suffer physical punishment and or psychological violence at the hands of parents and caregivers. That allows us to know how prevalent abuse and neglect is worldwide. What are the reasons that put a person at risk for abusing a child? It's perhaps having a history of being abused themselves, abusing substances, poor parent-child relationships, socioeconomic status stress from unemployment, financial strain, or medical issues, lack of understanding child developmental stages, lack of parental skills, caring for a child with intellectual disabilities because they are at an increased rate for being abused, and familial stress and or crisis. The graphic to the right shows what is child abuse, and it displays the different actions that are considered child abuse. Almost 3/4, or 70% of child fatalities involve children younger than 3 years. Children younger than 1 year accounted for 45.4% of all fatalities. Young children are the most vulnerable for several reasons. They're dependent on their caregivers, they're very small, and they have an inability to defend themselves. Child abuse in infancy is a major deal because of the high levels of deaths associated with this age group, and because this time period is crucial for their cognitive development. The graphic to the left shows the fatalities from child abuse and neglect by age group. As you can see, younger than 1 year accounts for 45.4% of fatalities. Issues of abuse during childhood. Although this age group has a lower chance of fatally being abused, this is still a crucial time for many different cognitive abilities that are still being developed. Abuse occurring during childhood can create numerous amounts of issues. There are very many behavioral consequences of abuse, especially during this time period. Abuse can lead to unhealthy sexual practices, juvenile delinquency, alcohol and drug usage, and then they may continue the cycle of abuse, unfortunately. But during this period, brain functioning can be altered. So the amygdala, hippocampus, orbitofrontal cortex, cerebellum, and corpus callosum have all been shown to reduce volume sizes and stunt proper development when faced with abuse. Issues of child abuse later in life. Abuse early on can affect you in the later stages of adulthood as well. So here's a list of some medical problems that abuse puts you at a higher risk for: diabetes, lung disease, vision problems, heart attack, arthritis, high blood pressure, brain damage, COPD, cancer, stroke, bowel disease, and chronic fatigue syndrome. This is an interesting topic because of how abuse can affect you early on in life and give you not only psychological but medical problems in your adulthood stages as well. I've spent the last several minutes explaining all the terrible, terrible things associated with childhood abuse and neglect, but how do we assist victims of it? Here are 2 peer-reviewed sources that can affect how we treat victims of abuse and neglect. The first treatment I'm going to describe is multisystemic therapy for child abuse and neglect. So in this study presented in front of you, families were identified as a parent-child dyad that were referred to this therapy by Child Protective Services or a social worker. And they were also given this therapy for reasons of abuse and neglect. Participating families actively engaged in this therapy in their personal homes led by a therapist for 6 to 9 months. The overall findings of this was a decrease in perceived parental stress resulted in a decrease of abuse and neglect. So what does this really mean? It means that parents are stressed, and when given therapy, their levels of stress do decrease and the levels of abuse and neglect decrease as well. So as professionals, we should be using multisystemic therapy to assist parental stress. The next therapy I'm going to describe is trauma-focused cognitive behavioral therapy. And this is a therapy that I'm particularly interested in and have learned a great deal about over the past 4 years at Missouri State. This therapy has been empirically investigated over 20 different times, so it's a pretty sound therapy. So what is TFCBT? It is trauma-focused cognitive behavioral therapy. It's an evidence-based treatment approach shown to help children, adolescents, and their parents overcome trauma-related difficulties. This therapy assists the children in addressing their trauma and overcome problematic thoughts and behaviors that have surfaced due to the trauma that has occurred. The overall target population for this therapy would be those at least 3 years of age and have been exposed to at least one trauma throughout their life. Or also a parental figure that is non-abusive can benefit greatly from this behavioral therapy. Those using this therapy may be experiencing symptoms of PTSD, depression, anxiety, or inappropriate sexual behaviors, or really any problematic behavioral symptoms that may be linked to the trauma they have experienced. This therapy follows the practice model. So it goes psychoeducation, parenting skills, relaxation skills, affective modulation skills, cognitive coping skills, trauma narrative and processing, and we move into the closure phase, which is in vivo mastery of trauma reminders, conjoint youth caregiver sections, and enhancing safety. I've talked a lot about assisting the victims of child abuse and neglect, but let's shift our gears towards resources for parents who may be neglecting their child due to inadequate skills. So, sometimes parental skills don't necessarily come naturally. Others may need assistance in knowing the developmental stages of their children or other aspects of parenting. Parent education programs are designed to help parents understand their children's individual needs and development, as well as their own roles and responsibilities by offering them tools and strategies aimed at maximizing positive relationships for the children and families. And this is by Child Welfare Information Gateway 2019. Here are some well-researched programs to assist those needing guidance. Incredible Years, Nurturing Fathers Program, Parent-Child Interaction Therapy, Safe Care, Triple P Positive Parenting Program, Circle of Security, and Combined Parent-Child Cognitive Behavioral Therapy, and lastly, Nurturing Parenting Program.